Well, it's an occupational lung disease that is affecting mostly young male workers. Essentially, it's caused by inhaling very fine particles of silica dust. So these are particles that are 1/100th the size of a grain of sand. And instead of the body being able to get rid of that dust, it goes deep into the lungs, causing inflammation and scarring or fibrosis.
And it has mainly affected workers working in kitchen renovations. We're talking about benches, Caesar stone benches
Sure.
especially.
So it is the cutting of those benches, but it's also other construction industries that do tunnelling through sandstone. It also has a very high silica content as well.
Liam, we've known for a while that this is a problem. We've reported on the home renovations and kitchen benches before. Has anything improved safety-wise to this point?
Unfortunately not, Lisa. We see year after year reports of health and safety inspectors attending the same factories, issuing the same improvement notices, and the same workers continuing to be exposed. We've had report after report that has said we've got to act more, and we've had a report that says if we don't do something soon, we should ban this, and we say that time has come.
Okay, so you're calling on governments to ban altogether some of the products we're talking about?
Absolutely. We know that there are safe alternatives. This is a fashion product. It is not an essential building material. There are plenty of other ways in which we can build our kitchens. We don't need to be exposing thousands of workers to dangerous and deadly dust.
Jane, can you give us an example of a safer product, for instance?
So we know that the engineered stone has up to 95% silica in it. So other natural stones have much lower silica, but even things like timber, laminates, of course, that reduces the risk of silica exposure completely, which is obviously what we're really aiming to do.
A better option.
Liam, what are you hearing from your workers of just how fast they can see symptoms coming about if they've been part of the trade?
Well, Jane will be better to tell you, but ultimately we're seeing workers who have been exposed for less than 5 years and contracting silicosis. This is something that is very fast. If we think about comparisons to previous, really serious, deadly lung diseases, think about asbestos. Asbestos takes 30 years generally to manifest in somebody's body for symptoms to become present. We're seeing workers in a number of years exposed to such high quantities of dust that they're sick. And in many cases, it's fatal.
So, Jane, these timeframes can be very small.
Yes, so it's really related to both the amount of exposure and the duration of exposure. So somebody can be exposed to very high levels of silica and have symptoms even within a shorter time frame than the 5 years that Liam mentioned. So really what we're seeing is this accelerated form of silicosis, and that's where it's really emerged in the workers. So many people are being affected too. So we know about the numbers of workers who are exposed to silica in their workplace, 600,000 a year. And of those, it's predicted 100,000, a whole MCG worth of young men is going to be affected by this disease.
Just workers. We stress that these homeowners with Caesar stone are at no risk, but on that front, do you think many people would be horrified as they're perhaps watching us over a Caesar stone bench this morning in the kitchen, knowing about the impact on workers' healths in creating that?
I think absolutely. I think absolutely people are horrified that these products can cause such harm. We're also calling on consumers to think twice about the types of benches that you want to install in your house.
It seems like a no-brainer. What possible argument is there to not act and act swiftly?
Well, look, I'd say these engineered stone companies have had years to do something about it, and they've failed to act. They continue to push the pressure back down onto workers who say they should operate these things safely. Our view is there are safe alternatives. We need to take action to protect workers' health. We need to look at other products, including low silica content engineered stone products that can be used as substitutes.